Assalamualaikum viewers, welcome to my YouTube channel, The Study of Anatomy. Now let's start our today's topic, which is organs in sympathetic actions and parasympathetic actions. So let's start. Eye sympathetic action, contraction of iris, radial muscle, pupil dilate, relaxation of ciliary muscles. Parasympathetic actions में contraction of iris, sphincter muscles, pupil contracts, contraction of ciliary muscles, lens accommodates for near visions. Heart, increase rate, increase contractility, decrease rate, decreased contractility. Blood vessels, skeletal muscles, dilate, nil. Blood vessels, skin, mucous membrane, constriction, kidney, renine section, increase, beta 1, alpha 1 decrease. Trachea and bronchioles, dilate, constrict, increase secretions. Gastrointestinal contraction of sphincters, decrease in muscle motility and tone, increased muscle motility and tone. Genitalia stimulate ejaculation, stimulate erection. Genitalia female, relaxation of uterus. Salivary gland, thick viscous secretion, large watery secretion. Adrenal medulla, epinephrine and norepinephrine secreted. Lacrimal gland stimulates tears. Now, prototypes drugs of ANS. Prototype drug definition. A first or preliminary form of drug from which other forms of drugs are developed or copied is called prototype drug. Drugs affecting the autonomic nervous systems are divided into two groups according to the types of neuron involved in their mechanism of actions. Group 1, cholinergic drugs or parasympathetic drugs. Cholinergic drugs or parasympathetic drugs. Group 2 is the adrenergic drugs or sympathetic drugs. Now we will discuss cholinergic drug, parasympathetic drugs. These drugs are classified into cholinergic agonist or parasympathomimetic, cholinergic antagonist or parasympathetolytic. Cholinergic agonists, parasympathomimetics. Here is the list of prototype cholinergic agonists: direct acting acetylcholine, indirect acting reversible physostigmine, yes, indirect acting irreversible acethophate, reactivation of acetylcholine esterase pralidoxime, acetylcholine direct acting. Acetylcholine is a quaternary ammonium compound that cannot penetrate membrane. It is neurotransmitter of parasympathetic and somatic nerves as well as autonomic ganglia. It is rapidly inactivated by acetylcholinesterase. Duration of action of acetylcholine is small, a few milliseconds. Hence, it is not used in the therapeutics. Acetylcholine has been muscarinic and nicotinic activities. Action of acetylcholine. It has following major actions: decrease in heart rate and cardiac output, decrease in blood pressures. Other actions: decrease in heart rate and cardiac outputs. This is decrease in heart rate and cardiac outputs. Acetylcholine mimics the effect of vagal stimulation. As a result, decrease in heart rate and cardiac output, decrease in blood pressures. Injection of acetylcholine causes vasodilation and lowering the blood pressure. Other actions Other actions. In GIT, acetylcholine increases salivary secretion, intestinal secretions, and motility. It enhances secretions in bronchioles. It stimulates erections in eye. It causes contraction of iris, sphincter muscle, pupil contraction, which is called meiosis. It causes contraction of ciliary muscles. Lens accommodates for near visions. Therapeutic actions. Acetylcholine 1% solution is instilled into the eye to produce meiosis during ophthalmic surgery. Adverse effects of cholinergic drugs: diarrhea, meiosis, nausea, urinary urgency, bradycardia, bronchoconstrictions, AV block, flushing, salivation. Physostigmine indirect acting.